Good morning, student. In our last video, we are discussing about management of soft tissue injury. Soft tissue injury means injury to skin and muscles. Skin injury like contusions, abrasions, lacerations, incision, etc. And muscle injury are uh, injury to the muscles like tendons, ligament, etc. Today we will discuss about heart tissue injury, management of heart tissue injury. Heart tissue injury means bone injury, injury to the bones. Bone injury is a serious injury and it is very painful. If bone injury is not handled properly, it may lead to permanent disability. Okay, if the bone injury is not handled properly, it may lead to permanent disability. If the injury changes into disability, it can't be cured. So the bone injury is to be handled carefully. Thus the bone injury has to be handled only by the expert doctors. The first step of the bone injury is to immobilize the part. Means no movement of the injured part and stop bleeding. We can stop bleeding by using the ice. Using ice therapy. Using ice, it helps in internal and external bleeding. So, for bone injury, the first step is no movement, immobilize. Complete rest, don't do any movement, and then use ice to stop the bleeding, internal and external bleeding. Use ice therapy. Bone injury, it is further damage to in this way. If we use eye therapy, it will help to in this way the further damage can be avoided. Bone injury can be classified as dislocations and fractures. It is again of various types like simple and complicated, in which blood vessels or nerves are damaged. Let's discuss first dislocation. Dislocation is an injury of joint in which the adjoining bones are displaced from their original positions. Means displacement of joint from its position, from its normal positions. Okay, this location means displacement of joint from its normal position in the joint, or the two connected bones. In dislocation, the two connected bones, like here, in dislocation, this two connected bones displace from its original place. Okay, it displaced from its original place. The cause of dislocation is due to direct or indirect impact over the joint. Due to direct hit or indirect impact over the joint. And dislocation may be simple dislocations, fracture dislocations, or complicated dislocations. Deformity may arise if the proper treatment is not given properly. Dislocation is common. This dislocation is common in throwing event, jumping event, etc. And dislocation, preventions of dislocation. Dislocations can be prevented by strengthening the muscles, means increasing the strength of the muscle. If the strength of the muscle improve, it helps to prevent dislocations. Performing proper warming up, controlling excessive range of movement of the joint. Okay, uh, excessive excessive range of movement, overstretching of joint, controlling the overstretching of joint and avoiding jerky movement, we can prevent dislocation. Okay, so dislocation means displacement of joint from its normal place. The it can be the cause of Dislocation is due to direct or indirect impact over the joint. And preventions, dislocation can be prevented through proper warming up, avoiding jerky movement, controlling maximum range of movement of joint, excessive range of movement joint, and and treatment is first immobilize movement, don't complete rest, don't do any movement. And second is icing, icings to control the internal bleeding with the help of icing, with the help of of immobilizations of joint. And doing icing, it helps to prevent further damage. And then after that, support. Okay, for treatment, first is rise, first is don't do any movement, and then apply ice, so that um, it helps to control internal bleeding. Third is provide support by using band-aids or clothes. Okay, provide the support of the injured hand or injured part with the help support band-aids. And go to the hospitals, have the x-ray and other diagnosis should be done properly. Next is fracture. In this injury, bones break up by some external pressures. Means fractures means cracking or breaking of bone. There, there may be slight breakage or complete breakage of bone. Okay, in fractures, there will be the cracking or breaking of bones. Fractures may be simple or complicated. Incomplete or wrong treatment of fractures may be dangerous. Therefore, it should be handled only by the expert doctors. The first step are to stop bleeding. The first step is complete rest, no movement, and then use ice. Okay, stop bleeding and restrict further movement. Further, the victims to the hospitals. The further that the victims to the hospitals as the earliest. Fractures can be categorized as closed fractures and open fractures. Closed fractures is also known as simple fractures. In these fractures, uh, broken bones remain inside the covering of skin. Okay, in closed fractures, the bones break and it's remain inside the skin. That is, there is no open cut over the skin. The bones remain inside the skin. There is no cut over the skin. In open fractures, there is a cut over the skin by the sharp edge of the broken bones or by any external object along with broken bones or bones. Okay, in closed fractures, bones break and it's remain inside the covering of the skin. There is no cut over the skin. And in open fractures, the bones break and there is a cut over the skin by the sharp edge of the broken bones or by the external object. Fractures um, are for this group as categorized. Fractures can be categorized as complete fractures. Complete fractures means when the bones totally break down into two pieces. Okay, in complete fractures, the bones break completely into two pieces. Incomplete fractures means the bones is cracked or partially breaking of bones. Incomplete fractures, the brains does not break. There is only cracking of bones or only partial breaking of the bones. Green stick Green stick, or we can say hairline fractures. In green stick fractures, when the bones when the bone is bent with mild cracking, the bones does not break completely. Okay, green stick fractures. This green stick fractures is commonly seen in children's because their bones are delicate and bent uh, can be bent on any stress they pose. In green stick fractures, the bone is bent, slightly bent, and there is a cracking with no complete breaking. It is mainly seen in children's bones. Comminuted fractures. Comminuted fractures means the bones is broke up into many small pieces at the site of fractures. In comminuted fractures, at the site of fractures, the bones break up into many small pieces. Impact fractures. In impact fractures, the broken bones is driven, means moved into another's broken bones, or when the broken bones and um, protrude, means strike into the other's bones or part by the sudden impact. Means in impact fractures, the broken bones drive, means move into another's broken bones. Transverse fractures. In transverse fractures, okay, impact fractures means broken bones enters into another bones. Next is transverse fractures. Transverse fractures is caused due to breaking of bones at right angles with axis of bones. Means in transverse fractures, the bones break bones. The breaking bones is in straight lines across the bones or fractures line. In transverse fractures, the fractures lines runs horizontally due to direct blow, or when the fractures is from one side to another's. You can see here, this is transverse fractures. There is a slide, there is a straight line, okay, straight line. This is known as transverse fractures, means causing of the bones breaking of bones at right angle with the axis, or we can say fractures line run horizontally due to direct blow. Next is stress fractures. Stress fractures is also known as hairline fractures. It is caused by repeated stress over the time, and it is mainly seen in jumping event. Bone is pressed from corners and it causes partial damage to the bones. Okay, stress fractures means it is due to repeated stress over the bones. Oblique fractures means the bones break diagonally. In oblique fractures, the bones break diagonally. Oblique fractures tend to occur on long bones. It is mainly seen in long bones. The bones break diagonally. Compound fractures. Compound fractures means breaking of bones along with dislocation. In compound fractures, the bones break along with dislocation. Complicated fractures. Complicated fractures means the bone is crushed. Moreover, the delicate organs like brain, heart, livers, kidney, nerves, blood, etc. are damaged by it. Okay, complicated fractures means the bone is crushed into small piece, and the bones, okay, the delicate organs like bones, delicate organs like brains, heart, kidney, blood vessel, etc. are damaged by it. These are the uh, these are the types of fractures, category of fractures. Okay, first it is categorized as simple fractures and compound fractures, or we can say closed fractures or open fractures. And next is further it is grouped as complete fractures. Okay, complete fractures, incomplete fractures, green stick fractures, comminuted fractures, impact fractures, transverse fractures, stress fractures, oblique fractures, compound fractures, and complicated fractures. Let's discuss symptoms. Symptoms of bone injury. What are the symptoms of bone injury? Bone injury means that dislocation addresses fractures. What are the symptoms? First is severe pain around the joint, around the fractures or around the joint or bones. Okay, symptoms of bone injury. First is severe pain around the joint or bones. Second is the joint or bone will look deformity and the swelling around the affected parts. There will be the its look different, and there is swelling over the affected parts. The joint or the bones will appear fixed. There is no movement possible. In the joint or bones, no movement is possible. And the temperatures, local temperatures rise, and the fractures part is deformed. These are the symptoms of bone. First is there is a severe pain around the fractures or around the joint. The joint or the bones look different due to swelling around the affected part. The bones or joint appears fixed. There no movement is possible. There is no movement possible. And the temperatures of the human being rise, and the fractures path is deformed, means not having natural shape. Okay, the fractures path is deformed means it is not look normal. Okay, not having a natural shape. First aid and management of bone injury. First aid. The first is do not move the joint or move bones. The victim should be kept at a comfortable positions. No movement. There should be a no movement of joint or the bones. It should be complete rest. Second is apply cold pack or ice pack to reduce the pain, swelling or internal bleeding. The second step is use ice. It's had to reduce swelling as well as reduce the internal bleeding. Third step is provide support by using string or splint bandage sling to prevent further movement. Moreover, it gives relief to the victims. Okay, third step is provide the injured part with the help of using a string. ठीक है, किसी भी कपड़े से या बैंडेज से support the affected part. Next is the patient should be handled by the expert doctors. The bones and the dislocation, fractures and dislocation, it should be handled only by the expert doctors, and the X-ray and others diagnosis should be done properly. The expert should manage immobility, means no movement, by applying plasters. Okay, using plasters it helps to immobilize the bones so as to enable the joint to take its real position. Fourth is this immobilizations should be 3 to 6 weeks as per the advice, means no movement of the bones or joint for approx 3 to 6 weeks so that its take its normal or real position. Last is after full treatment of the dislocate joint or the bones. Okay, after the full treatment of the dislocation joints or bones fractures, Follow the progressive rehabilitations. Do a rehabilitations exercise or physiotherapy to regain the strength of the joint or bones under the observation of expert. Last step is do a rehabilitation exercise or physiotherapy only under the expert observation. Rehabilitation exercise helps to regain the strength of the joints and bones. These are the first aid and management of bone injury. Endurance depends upon maximum oxygen's uptake. Okay, maximum oxygen's uptake. Speed determining factors is white muscle fibers also known as fast twitch muscle fibers. The persons who have white muscle fibers, they have more speed, and the persons who have red muscle fibers or slow twist muscle fibers, they have more endurance. And output is the ability to pump out blood in 1 minute. Cardiorespiratory systems improve heart heart size, increase the size of the heart, lungs volume, new capillaries are formed, and this all are the cardiorespiratory systems helps to improve. So we have complete this chapters. Okay, sports medicine. Today we have to finish the topic sports medicines. So sports medicine means treatment of injury or illness related to स्पोर्ट्स इंजरी. ठीक है, स्पोर्ट्स इंजरी से जो भी स्पोर्ट्स से जो भी इंजरी होती है उसका ट्रीटमेंट करना. ठीक है, इट्स नोन एज स्पोर्ट्स मेडिसिन. एंड फर्स्ट एड इज द इमीडिएट and temporary aid given to the victim. Okay, first aid means immediate and temporary care given to the victims before the arrivals of the doctors. The motive of first aid is to save life without thinking what to do, what to not to do. So first aid helps to avoid further injury. And objective of first aid is immediate aid. Think about ABC, airway, breathing, and compressions. Stop bleeding. If there is any bleeding, stop it. Crowd should be kept away. Okay, crowd should be kept away. And wrap the injured persons with a cloth, a sympathetic attitude, and fluid should not be given. Waters or juice should not be given to the unconscious persons. And medical aid means the first aiders should call the doctors. Muscle injury means soft tissue injury. There are two type of injury: soft tissue injury and hard tissue injury. Soft tissue injury, there are skin injury and muscle injury. Skin injury like cramp means inability. Soft tissue injury. First look at here, management of soft tissue injury. Contusion means it is the injury. Contusion is the injury of the skin caused by severe blow or direct hit. Contusion is due to direct hit by an external object without the breaking of continuity of skin. There is no breaking of skin. The color of the skin changes from red or blue. The color of the skin changes, and it is due to direct hit by the external object. And the treatment for a soft tissue injury is RICE. First step is rest. Treatment for muscle injury, RICE. First, rest, ice, compressions, elevations, and rehabilitation. Abrasions means abrasion means accidentally rubbing of skin. ठीक है. Abrasion means rubbing of skin over the rough surface or due to friction. ठीक है. Abrasion means rubbing of skin over the rough surface or um, it is rubbed by the friction. Lacerations. It is laceration is a soft tissue injury. It is a soft tissue injury in which the bones are torn, and it is by a blunt object. And incision, it is also a soft tissue injury and caused by sharp edge object. Muscle injury are cramp and sprain, strain. Cramp means inability of the muscle to contract. Okay, inability of muscle to contract properly, or unbalanced contractions of muscles. It is due to overstretching of muscles. Strain is tearing or damage of the muscles, or we can say muscle pull. Okay, strain means strain. Okay, strain means strain. It is due to twist, pull, or tear of muscle or the tendon. Tendon connect muscles. Tendon connect muscle to muscles. So strain means due to tearing of muscle. Sprain means tearing or damage of ligament. Ligaments connect bones to bones. Okay, sprain means stretching or tearing or damage of ligament, and ligaments connect joint to joint. And sprain is due to overstretching of ligament or twisting of joint, or due to jerky movement. The management of soft tissue injury is rest. First is complete rest, then ice. Compression means bandage. With the help of bandage, compress the injured part, so it's help to reduce the swelling. Elevation means the injured part should be kept above the heart levels. अपने heart level से ऊपर उठाना. For example, if there is injury in the leg, means then evaluate means अपने leg को heart level से ऊपर उठाना. Elevate the injured part above the heart levels. And last is refers and rehabilitations. After the treatment is over, do a rehabilitation exercise to regain the strength of the muscles, or regain the strength of the muscles, bones, etc. Last is rehabilitation. Next is heart tissue injury. Heart tissue injury means bones injury, that is dislocation and fractures. Okay, heart tissue injury, bone injury, that is dislocation and fractures. In dislocations, the bones okay, in this dislocation, there is displacement of joint from its normal position. The adjoining bones are displaced from their normal position. जो bones है, it will come out from its normal position. Means two connected bones slip out from its normal position. And fractures means cracking, breaking of bones. And these are the types of fractures. Transverse fractures, the straight line, linear fractures, oblique fractures. Okay, oblique fractures, spirals due to twisting of bones. Spiral fractures, granite fractures, the bones bend. There is a bending of bones with slight cracking. over the bones. Okay, the bones bend with slight cracking. And then comminuted fractures means bones is crushed. The bone is crushed, and it and the bone is crushed. In complicated fractures, the bone is crushed, and it also affect the delicate organs. The crushing bones affect the delicate organs like brain, kidney, mind, etc. And symptoms. The symptoms is there is a severe pain. The the injured bones or the joint not not having natural shape. Okay, it's not look like a natural shape. The temperatures, increase in temperatures, bones look deformity and swelling up around the affected parts, and the movement is not possible. Management: first, complete rest, no movement. Second, apply ice. Third, support it with the help of string. Okay, string means patti या फिर bandage. Support it so that the no movement will be possible. Okay, so to avoid the forward movement, support by using the string or split bandage, and then go to the hospitals, and it should be handled by the expert doctors, have a x-ray and other diagnosis. And last is immobility, no movement for, and the plasters, do the plasters and no movement for 3 to 6 weeks. After the treatment, do a rehabilitation exercise and physiotherapy to regain the strength of the joint and muscles.